Electronics and Communication Engineering, National Institute of Technical Teachers Training and Research, Chennai. I also welcome all the faculties and the participants who are here today. We are proud to organize a virtual learning initiative on telemedicine and Internet of Things in healthcare, a collaborative program with Unnat Bharat Abhiyan AAROGYA series. To begin this auspicious occasion, let us invoke the presence of Almighty. Priya ma'am.
நீராறும் கடலுடுத்த நிலமடந்தை கெழிலொழுகும் சீராறும் மதனமென திகழ்வரத கண்டமிதில் எக்கணமும் அதில் சிறந்த திராவிடனல் திருநாடும் தக்க சிறு பிறை முதலும் தரித்தனரும் திலகமுமே அத்திலக வாசனை போல் அனைத்துலகும் இன்பமுற எத்திசையும் புகழ் மணக்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிழமை திறம்பியந்து செயல் மறந்து வாழ்த்துதுமே வாழ்த்துதுமே வாழ்த்துதுமே.
Dr. B. Sendilkumar, Dean and Director of School of Allied Health Sciences, Vinaha Mission's Research Foundation, deemed to be university, hails from the beautiful temple city of Kanchipuram in India and has acquired the following qualifications starting from BDS, MBA, MPH, MPhil, HSSM, PhD, DLIT, DSc, FISTO, FAASS, FRSPH UK, FSA PHO UK and MTP in HM and DA IIM Ahmedabad. He is also a qualified NABH assessor, C2 SR EHS assessor, certified Six Sigma Black Belt in quality, ISO lead auditor for ISO 9001 2015, ISO 14001 2015, ISO 45001 and 2018, ISO 21001 2018 standards. Administering nearly 20 UG and 11 PG courses in allied health sciences at 3 different campuses in Salem, Puducherry, and Karaikal. Since July 2018, he has been serving as head transformation for the Vinaha Mission Hospital, Salem, and as an additional responsibility, oversees its overall operations and is also responsible for ensuring that the hospital's quality of service, efficiency, and customer satisfaction is at its highest at all times. Ensure Diploma in Family Medicine and Diploma in Emergency Medicine courses are accredited with Royal College of General Practitioners UK, an executive member in Purchase Committee of the WIMS Hospital Salem, executive member in NABH Accreditation Process and Quality Control Board in the WIMS Hospital Salem, a convener for the Infection Control Committee, WIMS Hospital Salem, a chief executive member of the Ethical Committee, WIMS Hospital Salem, and a chief executive in International Affairs of the Vinaha Missions and working out for the collaboration with Harvard University. He also holds the valuable post and membership of being the chairman, Board of Studies, Allied Health Sciences, Vinaha Missions Research Foundation, Salem, a subcommittee member in C2 Southern Region on Education, Skills and Job Creation for the year 2021 to 2022, a member in C2 Tamil Nadu Healthcare Panel, member in C2 Tamil Nadu Education and Skills for the year 2021 to 2022. Recently, we recognized as a Beat COVID campaign institution from MGNCRE under the guidance and support of a Dean Professor Dr. B. Sendilkumar. With a rich 25 years of experience, including academics, he has published 25 research papers and articles, had been invited as a guest speaker and panelist in and around 30 international and national events, organized 20 international and national conferences, and 100 plus webinars. As a recognition for his outstanding and excellent contribution to various academic and research activities, he had been awarded 21 prestigious and honorary awards by different international and national conclaves. The CSR activities organized by him for the benefit of the society has been well appreciated and acclaimed by the people of all sectors. His vision is to work towards an education system of equal access to all. He is a dynamic and versatile person having a quest for knowledge and is continuously marching towards success. It's my pleasure to invite our Dean, Professor Dr. B. Sendilkumar, sir, a UBA coordinator and Vinaya Mission Research Foundation Dean to the University of Salem, to deliver the welcome note.
Thanks, Ashwini. Thanks for the wonderful introduction. Yeah, cheerful morning and very warm welcome to our honorable guest speaker of the day, Professor Dr. G. Kulanthaivel, Professor and Head, Department of Electronics and Communication Engineering, National Institute of Technical Teachers Training and Research, under Ministry of Education, Government of India, Chennai. And I also welcome Professor Dr. B.S. Moti, Institute Chair Professor, Department of Civil Engineering and Coordinator of Regional Coordinating Institute, Unnat, IIT Madras. My dear faculty, students and all participants to the webinar on a virtual learning initiative on telemedicine and Internet of Things in healthcare, organized by School of Allied Sciences, Vinaya Mission Research Foundation, Dept University, as a part of Unnat Bharat AAROGYA series. The Internet of Things refers to technology that connects physical objects to the Internet, where it boon for healthcare systems, especially telemedicine. IoT is developing and changing the way healthcare facilities, including remote patient monitoring, are delivered through existing interconnected technology. The healthcare industry has changed rapidly over the years. Technology has impacted the healthcare industry by digitizing all the steps, especially from lab tests to self-kit tools. The healthcare tech industry is the largest beneficiary of Internet of Things, while telemedicine received a new phase. Telemedicine technology helps people located in remote areas or the ones who are unable to visit the doctors and hospitals due to factors like distance, age, or busy lifestyle. It provides remote care and virtual healthcare assistance, which is more affordable and convenient for healthcare professionals and patients. Telemedicine is also effective for people suffering from serious ailments such as kidney disease, heart ailment, respiratory diseases like chronic obstructive pulmonary COPD, diabetes that requires constant monitoring by the doctors. This saves rushing to the hospital at the last moment, high expense of readmission in the hospitals, and in rare cases save the patients from death by giving treatment remotely at the right moment. Pervasive and wearable devices powered by IoT play an important role by allowing doctors to access relevant information. For example, patient wearing a Holter monitor device will enable doctors and patient to check abnormalities if it is occurred in the heartbeat. IoT devices will not only help people, especially senior citizens, improve their health conditions, but also it will boon for people with disabilities. IoT is going to be omnipresent. It has enormous potential in healthcare, especially in telemedicine, as the latest technologies keep on getting introduced in the healthcare sector. The IoT in telemedicine is also forcing to witness substantial growth. Busy lifestyle and technological advancements both collectively are focused on providing more comfort and convenience to patients as well as the doctor. I believe in the quote by Julia Gillard, former Prime Minister of Australia, our future growth relies on competitive and innovation, skills and productivity, and this in turn rely on the education. We at School of Allied Sciences work towards providing the education and lead our students to be skillful and innovative. I appreciate the organizers for this need of our webinar, and once again extend my warm welcome and many thanks to our guest speaker, Dr. Kulanthaivel, for sharing his valuable time and knowledge with us. Thank you all and wishing you all a great day. Have a great, happy learning.
Thank you, Dean Sir. Professor Dr. G. Kulanthaivel, Professor and Head of the Department of Electronics and Communication Engineering, National Institute of Technical Teachers Training and Research, Ministry of Education, Government of India, Chennai, India, received his PhD degree in Information and Communication Engineering from Anna University, Chennai. He completed his master's degree in Microwave and Optical Engineering from Madurai Kamaraj University and bachelor's degree in Electronics and Communication Engineering from the University of Madras. He is having experience for more than 28 years, out of which more than 25 years in training of technical teachers in India and abroad. He has worked in Colombo Plant Staff College, Manila, Philippines as faculty as consultant and chairman of the Information and Communication Technology Division for nearly 4 years on Government of India deputation. He also acted as the acting Director General of CPSE for more than 1 year. He is an accreditor for Asia Pacific Accreditation and Certification Commission. His area of interest includes biomedical engineering, telemedicine, computer networking, communication engineering, IoT and cyber physical systems, virtual instrumentation, ICT applications in education and training, TVIT, accreditation, instructional design and delivery system. He has published and presented many papers in the national and international journals and conferences. He has visited around 20 countries and conducted different quality improvement programs. He is a member of many international and national professional bodies, including Institute of Electrical and Electronics Engineering and International Vocational Education and Training Association. He is fellow of the Institution of Electronics and Telecommunication Engineers, fellow of the Institution of Engineers, and recently chairman of IEEE Technology and Engineering Management Society. I now request Professor Dr. G. Kulanthaivel, sir, to take over the session. Please, sir. Sir, your audio is muted, sir.
I'll share my screen. I think
Yeah, sure.
whether any permission should be given?
No, sir. You can share this.
Okay. One second, I'm doing this. Okay. Great. Okay, hope you are able to see this.
Yes, sir.
Okay?
Yeah,
Okay.
yes, sir.
So good morning to all. On behalf of NITTTR, I congratulate the team behind this Unnat Bharat Gram Arogya series, like virtual learning initiative on telemedicine and Internet of Things. And we are really happy that your team, especially the Dean and Director AHS, Professor Dr. B. Sendilkumar, UBA Coordinator of Arogya Missions Research Foundation, is taking such a nice initiative. Because when Dr. R. Dhanasegar, UBA Program Officer, contacted me, so for the medical college, just and nursing colleges and allied health sciences, he wants to take a topic. So immediately we discuss and finalize this telemedicine and Internet of Things in healthcare is very good, because which is the emerging area. So here we wish to congratulate the team behind this. I also thank Professor Dr. B.S. Moti, Institute Chair Professor, Department of Civil Engineering, and Coordinator of Regional Coordinating Institute, Unnat Bharat Abhiyan IIT Madras, for permitting us to conduct this program. So I welcome all the participants from different parts of India, because this is my passion actually. So I'm basically completed my bachelor's degree in electronics and communication engineering, as mentioned by our in charge. And then I have done in microwave and optical communication engineering. Then I have done my PhD in biomedical engineering. As I'm telling, I started around 98, 99 itself to do the PhD. But those days, this computer networking concept or this whatever we are talking, web-based things, all these things are new. So with the help of, because I was taking care of my campus network, I was thinking, why can't we do whichever is available as a project individually? Why can't we make it international level? That means open to public. Because when we are doing some experiment, because most of people we are doing, like especially I'm telling about engineering colleges, when we do finally a projects, like I remember in 1991 I completed my B project, which was something related to ECG simulation using electronic components. So whatever I did, lot of things happened, lot of changes, but we have done somewhat very easy one, or those days it was little bit less cost. That was the aim of our projects. So when I was doing my doctorate, I was thinking I have to make such a project, whatever people are doing individually, because most of us do like digital signal processing, or we call medical signal processing, because we have ECG, EEG, MGO, EOG, whatever signals are there. So we are seeing in one system, that's all. If I am seeing in Vinay Hospital or Ramchandra Hospital or Apollo Hospital, only there it is there. Why can't these signals can be analyzed and the analyzed output can't reach the patient who is in a remote location? So those days, I was really happy. Now when I am seeing all the technology developments, whatever I have done in 2004 and 5 is now everywhere. Okay, so what we want is the thing what is available individually inside a laboratory in one institution should be known to all. That was the aim before, and that is possible now. Because slowly I remember those days I was collecting ultrasound images from a Mediscan center in Chennai under Dr. Suresh. So I had to go and collect. Before that, they were not having this type of networking where they were storing the medical images. So I'm telling 15, 20 years back, okay? So slowly the networking concept came where the images started stored in a different network servers. So now for doing, especially in the research, many of us are having an opportunity to download the data from internet. That is now, it is not like database or some server. Now we started calling the concept called cloud computing. One example for cloud computing is Google. Everybody is using Google Mail. Okay, I can go and download any mail from any part of the world. Similarly, I don't know how many have observed Google Drive, where I can store any files which can be accessed from any part of the world. So that is why I have Google Doc, Google Slides. So no need of Microsoft Office, I can work there, which can be accessed anywhere. But everywhere we need internet. The same concept is used in our IoT in healthcare. Because whatever we do, a simple example I can tell you. So assume we are doing like SpO2 testing. Okay, or I want to do a ECG. So what I used to do is, I used to go to a technician or I used to go to a hospital, connect like a 12 lead systems. So that same thing, now the technology has changed. Okay, the technology has changed such that I am going to have a small sensor, even like nano sensors have come. So which is going to help us a lot. So I can connect the sensor and I can use it anywhere. So that is how the world has changed now. So people can use something like a small sensors. Okay, it may be just like my pin. So from there, the data is going to be transferred to a hospital in a remote location, or to a doctor who is on the move. Okay, assume a doctor is on the move. He or she can see the ECG data or whatever images, like medical images, whatever you are getting is possible. So this is a simple concept of most of you are aware. Just like the video conferencing, what we are doing, that is possible. Whatever we are doing, like a video conference now we are doing, this is 5.0. Because as you know, all these days we are using the computers for patient monitoring. Okay, whatever you do from a patient or clinician, we are linking all these technologies. We may be using some database by which it is possible for us to do or see the data at a remote place. Maybe some senior officials, they may be knowing about telemetry concept. Okay, olden days, we started using like a RF antenna by which the signals were transmitted. At a remote place, we are able to see that. So like nowadays, we started calling as a web related thing. Any data, it may be like cardiac or ECG, heart rate or HRV with temperature or blood chemistry, whatever you want. It is possible for you to see the results. Everything are displayed. So patient monitoring, whatever we are doing, whatever you are doing inside a hospital, inside a ICU, inside a bed, near a bed, can be seen from any part of the world. This is what is happening. This, whether it's ECG or anything. So this was the development for the past 10, 15 years, whether it is related to medical information system or data reduction and transformation, because whatever data is there with you, it has to be transferred to a remote location. Because for everything you need internet. I don't know how many of you are aware of, especially juniors, you may not know. I remember like 1995, August 15, the internet was given to the public in India. Those days we called as public switch telephone network, the telephone which we are using in our houses, all the BSN landlines. So those lines we are using something like a modem, which we are converting the analog signal to digital and transfer to internet service provider through the network. Then we are receiving the data. Okay, that is modulated demod technique we call. But unfortunately, those days the speed was only technically we call 56 kilobits per second. The speed was very less. I still recall like 96, 97, when I wanted to show a demo to my students about what is internet technology. So it was only 56 kbps, even to show a 2 minutes video, like a trailer were there those days, movie trailer. It was very difficult to show to the students or my trainees, because more than 25 years I am working with my teachers only. Teachers are my trainees. So we are doing, so we train them. So in turn they train to the students. So the speed was very low. You have to think like bandwidth means small pipe. Small pipe means only less water will go. When the bandwidth is increased, more water can go. Similarly, the bandwidth of internet is good means more data can go. That is, the speed will be more. That is why nowadays what we do, like video conferencing, all the technology, telemedicine, we are using very good bandwidth. So slowly develop 2 Mbps, 4 Mbps, 8 Mbps. So now, like all our institutions, central government institutions, we are having 1 gigabits per second by national knowledge network. So this is the development is happening. So where it is possible to do data, whatever you are having, whether ECG or images or videos, ultrasound videos, whatever you are having, you can transmit easily through our network. So mathematical operation, ECG analysis, patient monitoring, statistical analysis of data, data presentation, patient history. So example I can tell you, like olden days, we used to write a prescription in the paper, doctors. But I say that most of my prescription, where it has gone, I don't know. But nowadays, every hospitals are having a good networks. So whenever you go, you are registered. Some registration number will be there, all your details. What are the medicines given by your doctors? All those things are there. That is done by like online now. So wherever I am in the world, it should be possible for me to access. So simply, I'm sorry to say that, assume I become unconscious when I visit somewhere. Because for your information, I was in Philippines for 4 years. I was traveling around 20 countries. Weekly, I have to go. Singapore, Malaysia, Thailand, or Fiji, or I can say up to Sri Lanka, Maldives, Pakistan, Afghanistan, Nepal, Bangladesh, Bhutan. I was traveling. Every week I have to go and conduct the program those days. Assume something happens to me, people may not know what is my blood group. Suddenly some unconscious. So that is why people are saying there should be like a smart card, which should be with your, like a visiting card, you have to keep it, where once you give the registration number, all your data should come. I'm sure it will come, like US, other countries, they are having like that. I'm sure one day it will come. But unfortunately, we have more population. I'm sure it may come one day. So like patient history, everything, whatever my data, patient, doctor's prescription, everything should be there past 10 years or 15 years. If it is coming, is good. So that is why a lot of things are happening. Computer-aided diagnosis is coming. So slowly what happened, this biotelemetry concept, we are using hospital and home were connected. Small data was there those days. Just for information I'm telling, okay, this is just to introduce you. So the technology was like this. We had to do something like a transmitter and it was sent to a receiver. In the receiver, we are using through just like antenna and we are receiving. That was the day. Even like ambulance people are using like this. So, but the technology is changed now, it's called telemedicine. It is the use of computers, internet and communication technologies to provide medical care to patients at a distance. Okay. So now because of technology, there is no need for the patient to travel to distance specialist. Assume somebody is there in Kanyakumari. He or she wants to meet a hospital like Apollo Hospital, like our telemedicine best doctor is Dr. Ganapati, like neuro doctor is there. Somebody wants to meet him, it's very difficult to meet him. So they can do it online. That is how it has come, the technology. I still remember we are using this type of all these things those days. But slowly the technology developed with the help of like some of the Sony or Ethira, Polycom cameras. Because I remember this, okay, I used to take classes like this type of cameras, okay. I can show you this type of cameras were there those days. Okay, these cameras. But I was sitting and taking, I think this was in 2004 or 5 itself. Because why I'm saying, I attended a telemedicine conference where I was seeing the doctors performing operations in India, which was given suggestion by US or UK doctors. This happened in 2004-5. Okay, based on that, I developed with the help of Ministry of Human Resource Development. We connected like Chennai, Bangalore, Hyderabad, Cochin, and we started the training. So my trainees were able to see me like this physically. Because physically I was not there, virtually they can see, but where they can view like this. There is no difference. Now what we are doing through Google or Zoom or this WebEx or GoToWebinar, all, whatever we are doing this happened in 2004-5, we had done this. So even like different centers we had done. This is how the that is discussions are happening in the hospitals. So we call this as teleconsultation, telediagnosis, teleeducation, teletraining, telemonitoring, telesupport. Simple is, even during this COVID-19, lot of consultation happened. Like doctors support us, no need to go to the hospital even during COVID situation. It is possible for us to sit from home. Only for testing, RT-PCR testing, blood from the lab people came and they gave the medicines, everything online. So these type of things are happening in the telemedicine. I think just because of time, like technology we are using like VSAT, some type of vans are there where people, this by ISRO initiative, okay, some like Kerala, they are having Shankar Netra, they are having, so they even go to villages. One day they will fix and tell, which is informed by putting tandoras or like this. Okay, there is a registration happening in the places, and one day they will come, the van will come and the technician will check like this. So which was, this is in a remote place, okay, which the doctor is seeing at a remote place. There is a consultation is happening. Okay, maybe quickly I can show you a video also later. Okay, this is what is happening. So this is one of things. Similarly, the images are traveled to by email to any part of the world. People are sending, so which they are discussing and analyzing, lot of things are happening. Okay, so like seeing a problematic image, the doctors at different places, they discuss and finally they analyze some, what is the problem, what type of things they want. So all these things are happening. Okay, so different devices they use. Okay, each institution you may be using, but whatever you are using in the hospitals, you need that. Mainly they want to have a video camera. Above then you have to have a networking systems. Okay, some different devices. Because of time I will not discuss. I will not discuss about the technologies. Time being, you think that there is something like network, internet network is there, which is useful. So all these concepts are called like e-health people are using, which is emerging, which is going to change the way we live. Already is in the process, no change. Lot of development have come, people are doing. Okay, just for your information, patient will be at the end somewhere. Okay, patient may be here. Okay, they may be taking some CT scan. Okay, or some discussion through the video conferencing camera. So all the data scanned or whatever it is sent through computers or PC, whatever, and we are using internet concept. So don't worry about this. As on date, you think as a medical professionals, you can analyze. Internet is used. At the remote places, the doctor's terminal, they may be having big, they may download through internet, or they will be seeing the patients through camera. So this is what is happening. Okay, I think because of this, just to show you, so this is how the Apollo Hospital, this Dr. Ganapati sir has given me, like what they had is in 1994, they had the village like this. They changed in 2000 itself like this. I'm sure even Naga Mission may be doing. I don't know how many participants from different places are attending. So in case your city or your hospital is not done, go for these things. So now more like they are doing different centers. They are having lot of technologies happening. Many hospitals are connected now. This is only few I am giving. So through internet they have connected. So for this we have to have the mindset. Whether I have to have this, I have to go for this. It's possible. So people are doing a lot, okay, like telecardiology. Maybe one I can quickly, because of time, because IoT also few things are there. Just I'll skip something. Like this, there are some vans. People travel. See, like this antenna. I'll move it. So it is going. The people are coming inside the van. So the testing will be done. So the signals are transmitted. The doctor at remote place will monitor, okay, and they will discuss. This is happening inside a van. The doctor at a remote place can see this. Okay, so a remote place, what is happening? So the example I can show you, which is one more I can show you quickly. So if you see here, doctor, a remote doctor is checking this, okay?
UC San Diego Medical Center stroke specialist Brett Meyer is examining a suspected stroke patient to determine whether she's a candidate for clot-busting drugs that can only be administered within a few hours of the onset of a stroke. But the patient is in an emergency room 140 miles away. Normally, Meyer would only be able to consult with the ER physician over the telephone. Instead, he is using advanced two-way audio and video internet technology dubbed Stroke Doc, a new telemedicine system.
Ma'am, I'm going to ask you to show me your teeth. Can you show me your teeth? Do what I'm doing. Show me your teeth. Okay, good. Keep them like that. Relax. The reason we want to look for a facial asymmetry in the smile is to see if maybe there's a droop of one side of the face or the other, which could be consistent with the stroke.
The technology developed at the University of California, San Diego, and tested on patients at 4 distant community hospitals could have an immediate and profound impact on the treatment of stroke patients around the world and on the use of telemedicine itself.
Okay, I think that's, I'll move.
Behind stroke, these position and
Telemedicine has come. Trials such as Stroke Doc, which have shown clear superiority of telemedicine over telephone for acute stroke decision-making, will enable more practitioners to use telemedicine in their daily practice.
Okay, so because of time, I have to skip this. So as I told you, there is just time being, you think you are having a video conferencing system where you are discussing with the doctor. Okay, patient will be discussing. So for sending all the data, we are using like email or like Google Drive concept, cloud concept, everything. So the same thing they thought, instead of using a device, like a ECG 12-lead systems, why can't you use a sensor? So that concept, from the sensor in my body, it will be transmitting the signal to a doctor at a remote place. Same thing, I think I'll just quickly skip, because this is what I told you, cyber physical system, don't worry, because lot of latest technology has come now. Okay, so what has happened is, the healthcare is there, means we are going to find out at a remote place. Okay, so patient will be in some place, whether the doctor may be moving, she or she can see in the mobile, or he or she, the centralized system they can see. Just some example I can say you, like a smart homes. Now it is coming. Okay, the simple example is, there is no need for me to switch on the light or switch on the fan. There will be a sensor to see the lighting condition in my house. So if it is becoming dark, automatically switch on. If it is already sunlight is there, it will switch on. Especially smart city, we are telling where the street lights are going to come like this. Okay, When it is going to become like dark, all the street lights will be switched on. When it is going to, sunlight is going to come, it is going to come. Switch on, off in the morning. So like this smart city, smart agriculture. One example is like farming. If you see, like we are putting water, okay, everywhere we are using sprinkler or something to put a water, but farming. So what is going to happen is there are sensors which will be kept in the mud. So it will analyze the mud, whether the water is there or not. If the mud is like dried, கொஞ்சம் காஞ்சிச்சுன்னா it will just open. That is sprinkler open money, it will send it. The sprinkler will open and water will flow. See, this is what is happening. Even like smart supply chain. So everywhere people are doing. Okay, I think in transportation, just to show you where is like smart grid, like you are having like wind energy or solar energy, because as on it is not distributed automatically. Somebody should do manually, but they have done that automatically. It will be distributed to different places. So like this is happening. People use lot of wearables. This is related to our biomedical or healthcare. So people may be using blood sensors or pulse oximeter nanosensor or nano micro interface or ECG sensor. So it is going through internet. It will be reaching the doctors. Okay, I think I'll skip some of the pictures. So different areas we are doing. So like watch has come now. I think you know, like Samsung watches, which will be transmitting the signal to our mobile. It's just like a fit band. Some of you may be using fit band in your hand like a watch. So the small sensor will be there, which is going to help you. I think this is how the picture. You may be wherever you are walking or moving, no problem. From you, through your mobile, the signal will be going to internet and it will be monitored at it. That's all. You remember that. You are going to use some sensor. Okay, different sensors are there. You are going to use like BP or temperature or even for ECG, different sensors we are going to use. It will be transmitted to a different distance place through internet, through cloud computing, the data, that is cloud. It will be stored and the doctors or nurses or everybody can see at a remote place. That's all. Don't worry about other things. So I'll just skip some more things. I don't want to give more on the data also. Okay. So technically, I don't want to do. People are having some companies are having different training boards they are having. So like this, there is just to demonstrate for engineers, you can have this type of thing. Really, if you know what to do, technology is there. We can purchase this type of smart health lab and test how it is working. I think I'll skip some of things. Okay, this is how the real architecture will be there. So you may be using some of the patient monitoring sensors. Okay. So even the room, you can have room condition, temperatures, everything, BP, everything. So we are going to have something like a chip ESP32 like this. Our supply will be there. Data from hospital environment. Okay, all these things will be going to through the web server, which I told you, user interface. It is going to reach the medical staff, whether doctors or nurses or whoever technicians, they are going to see. Okay, you can analyze from a remote place. That's all. Whatever you are all doing in your place as on date, that can be analyzed. You are going to get the remote place. Okay, so you may be using different sensors like this. Okay, something like body temperature. You can use like this heart using. Okay, people are using this. Can do. Technically, we do like this. Some of the experiments we do like this, and we check it. Okay, this is like the setup means we used to test form. We used to check like this, like a heartbeat, how many beats per second. Okay, like SpO2. So all these things we are doing. Maybe I can show you some pictures. Okay. Technically, we use something called Arduino, or we use Raspberry Pi like this. Technical things I don't want to cover much, but it is possible for us to do many of things, technical things. Okay, I think I can skip some of things, technical things. It is difficult for you to understand. Everywhere you are going to use a sensor which is going to help you. Okay, that is why we are calling all connected home, all these things we say. Okay, so people are using different because like Wi-Fi we have LOWPAN, lot of technologies there. Not like everything is going to help us. These are all which we are doing. Okay, as on date we are having. So we are getting like this lot of help. Then well, just few seconds I can. If it is okay, I can show you because of time. People Okay. Any device like a sensor, you can see, which is seen at a distance place. So the dog where it will be in the body. Okay, because I want to show some more things because different sensors are there. You can use this. So IoT is internet. That's all. Internet of things. That's all. Remember. So because just now we saw there was like a sensor. Somebody is touching that. So in the remote place, doctor can see that. That's all. Okay. These type of all electronics things. I'll leave this. Okay. So you can lot of things people are having. Okay. They are all using. As I told you, only it is cloud is helping us. So people, different parts of the body, we are taking their data. So all these things are going through cloud computing. So a lot of web interface. At the end, caregivers and monitoring service, they are taking care of that. Okay. So like this, people are getting lot of informations. Especially it is very much useful for the patients who are at a remote place. Okay, especially remote place, or I can say like especially older people, because they will not be able to walk to and go to the hospitals. And even sometimes we have to have a continuous monitoring. So those places it will be very much useful. You can have this. Okay. So that is how it is happening, all this telemonitoring. Because it's a vast topic, but I want to give you within few around 45 minutes, I have to show you. So it is very much useful from any parts of the body. It is possible for you to take it. So people can, especially, okay, it is very much useful. People can travel and people can work. So this is how people are using. So you have to use these things. And in anybody is really interested, these type of softwares like clouds are there. Okay, like Google or Amazon or Microsoft Azure. Really, if you want to have technically, if you want to develop your systems, but to get performance, you can approach them. Okay, like this is possible for you to. Okay, people are doing at different remote places. That's all. Okay, people, this is some real hardware. I think you may find it difficult. Okay, many things are happening. Just for your interest, I can show you quickly on this one video. That's also I have to, because of time, I have to move it.
Healthcare industry, collecting data from bedside devices, patient information, and diagnosing in real time. The entire system of patient care could be improved. To mention the patient experience. In 2019, 87% of all healthcare organizations will have implemented IoT technology. Today, many healthcare devices operate in silos. Over a third of healthcare organizations don't apply data from connected devices to other business processes. An issue that creates inefficiency, potential for data loss, and mistakes in diagnosis. Effective healthcare depends on speed and accuracy, and we have seen a huge range of devices becoming connected as IoT takes hold. Over 50% of devices on healthcare networks in the next 2 years will be IoT devices. Like those you see here, from handheld devices to health records to medical equipment, the industry is embracing the world of connected things. The common language and a single platform for these devices to operate, the potential for IoT is limitless. For caregivers, the ability to easily monitor and manage patient health can save precious minutes every day. Without having to manually visit each patient, the expert can give a remote diagnosis and track medical assets. providing quality care more quickly and managing the healthcare environment more efficiently. Using sensors and Wi-Fi, the ability to locate the right department in a hospital while retrieving essential information becomes straightforward for both caregivers and patients. Nearly 3/4 of healthcare leaders who have adopted IoT believe its key benefit will be to monitor and control medical devices and sensors. Patient heart monitors to temperature gauges. This real-time data already exists in healthcare. And now it can be used to create a safer and more effective environment. Through a single application on a mobile device, patients and staff can securely manage IoT data. IoT means an easier and more efficient patient care experience, allowing staff to do their jobs better.
Okay. Okay, because time is not there. This type of watches are coming. I am sure most of you are aware of this. You can see the like this. This is a reporter who has connected this everything in her body like 12 systems, and she wanted to check this. So this is what happened. You can see how it is done. So instead of
hooked up to a 12 lead EKG. Now I'm going to compare the results of this test versus the 1 lead EKG on the Apple Watch.
So this lead, one lead is mentioning the sensor is there. From there, the signal will be transferred to any part. But she is going to verify that 12 lead systems, what are ECGs they are getting and what they are getting from Apple Watch is the same, which can be analyzed. This is one example, that's all.
If I look at my apps now, I'll notice that there's now an EKG app here, and it's pretty simple to use. I just put my finger on the digital crown, start to take seconds. It usually shows it live.
In olden days, it was that much difficult. Now it is possible for us to see very easily. Okay, nobody expected this much earlier. Okay, technology. I think I want to move, but okay. Can you repeat?
Center hooked up to a 12 lead EKG. Now I'm going to compare the results of this test versus the 1 lead EKG on the Apple Watch. If I look at my apps now, I'll notice that there's now an EKG app, and it's pretty simple to use. I just put my finger on the digital crown and start to take down seconds. Actually shows it live.
See that.
The
This would be really useful to screen. First understanding that happening. It wouldn't tell us precisely where the heart. 12 lead EKG that gives us essentially a picture to tell us precisely where.
Am I going to die? Something wrong with me.
You are not going to die. These early beats are very common. Some people, they can lead to problems.
But let's take a look at how this actually works on the Apple Watch. An update to watchOS gave users access to 2 FDA-cleared features on the Apple Watch: an irregular heart rhythm notification and an EKG app exclusive to the Series 4, both of which could warn users of potentially life-threatening heart conditions. It is not new to the Apple Watch or wearables in general.
The optical sensor on fitness trackers, essentially.
and more blood is pumped into the vessels, more light gets absorbed. Between these pores less blood, more light gets reflected back into the receivers. The watch also uses this optical sensor to measure heart rhythm and alerts users when the pattern suggests atrial fibrillation, a heart condition which can increase your risk of stroke and other serious heart complications.
Anything about the pattern. Rhythm has more to do with relative spacing of.
To get a definitive diagnosis, the doctor needs more information.
We would want to have an electrical confirmation to diagnose the individual.
That's where the EKG comes in. The EKG, or electrocardiogram, uses electrodes to measure the electrical activity that results from each expansion and contraction of the heart. The Apple Watch has one electrode on the back crystal and one electrode on the digital crown. Place your finger on the digital crown to close the circuit and stay still for 30 seconds to get a read.
That's creating the same sort of connection. Left arm, right arm.
But the results from the single lead EKG on the Apple Watch, which users can share as a PDF with their doctors, gave Dr. Marcus enough information to detect my early heartbeat and could help doctors reach a diagnosis sooner.
Oh, I detect those in other words.
Okay. So just for idea only. So this is how it is happening now. Okay. People are doing like this. All these things. Okay. So it is on the move. It is possible to do these things. I think because of time, I think I already you are late. So a lot of things are happening around the world. So to conclude, I just quickly say that what I wanted to do is biomedical engineers and all the healthcare professionals, all the doctors, nurses, technicians, all of us should work together, because whatever you do inside a hospital, now we are going to reach the outside people. Okay, a person may be outside long distance. The remote person we are going to connect through we are going to connect through video conferencing. We are going to discuss all the data are going to come, whether it's email or that is fax, olden days people are using any medium. So through or Google Drive, you are going to have all the ECG signals or other signals or other images. So the doctors are going to do live chatting, because especially when a doctor and a patient is going to see, the patient will be really happy. Psychologically, I can say like 2-3 days, usually I take the medicines. It will not improve, my fever will not go. But when I take some medicines, after meeting a doctor, the same medicines, I'll feel well. So this is the real situation. So what I suggest is, so we have to have a real interaction with the doctors, so where the telemedicine helps. Similarly, especially this Internet of Health, it is very good. Like it decreases cost. No need for me to travel. Just sensor will be there in my body. Continuous monitoring can be done. Otherwise, I have to stay in the hospital. Especially, do you assume I am some heart patient? I am heart patient. I have to be monitored continuously in the hospital. Means everywhere corona patients were there few months back. Okay, in case I am there, I will be affected. So better I can stay in my home and do this. So all people can do, that is decrease cost, improved outcomes of treatment. So you have to have. So you please you have to be ready. So like treatment, best quality, it is from long distance. Expert doctor can come. It's not necessary I have to go and check my local place or somebody. So like cardiologist or nephrology, I can meet online and get it. So they'll be getting the result. Improve disease management, reduce error, enhance patient experience, because patients are really happy and they are able to do this. Okay, so this is how lot of developments are coming, so where people are doing. So what we have to do is, we have to change our mindset. Some people will say, sir, I don't know computers, sir, I don't know these things, I don't know much how to use. What I am suggesting is, whatever you are doing with the social media now, because I am sure most of you are using Instagram or Facebook or WhatsApp or Viber, different things we are using. If you are able to access those things, whatever is through IoT or telemedicine is very easy. So these new paradigms are emerging, and this will change the way very medicine is practiced in this century. So thank you for giving me opportunity. So I'm sure it is very less time. I have covered a lot of things. There's very less time. But anyway, I feel people if you are having some interest, okay, you can learn a lot, you can do this. So if you have anything, please contact me through my WhatsApp or you can contact me through Gmail. I'll be ready to support anything. So here I wish to thank all the team behind here. Okay, so it was really a good opportunity to discuss. Luckily, actually, I'm a biomedical engineer, so I'm really happy that I'm able to meet all the experts from health sciences. So I wish to thank Professor Dr. B. Sendilkumar, Dean Director also Professor B.S. Murthy, who is the coordinator of this Unnat Bharat Abhiyan for this area. And I wish to thank Dr. R. Dhanasegar, who be a program officer, for inviting me to do this. So thank you all. If you have any questions, please ask me. I can wait for a few more minutes because some people will be working. That is why they have maybe having plan or they have to go to other place. That's why I'm not doing. So if any questions, please ask me. Any questions?
No, sir.
Thank you.
Thank you. Thank you, Professor Dr. J. Kulanthaivel, sir. I now invite Dr. R. Dhanashekar, UBA Program Officer, School of Allied Health Sciences, Vanaha Mission Research Foundation, deemed to be University, Salem, to deliver the vote of thanks.
Thank you, sir. Thank you for the wonderful session.
Thank you. Thanks.
It's my pleasure to deliver a vote of thanks. I sincere my gratitude makes sense of your past, brings peace for today, and it creates a vision for tomorrow. Today, I take the opportunity to put all my gratitude into words. The School of Allied Health Sciences, Vinaya Missions Research Foundation, deemed to be University, and all the faculty members, first of all, from our bottom of our heart, we would like to thank to the Unnat Bharat Abhiyan officials, Professor Dr. B.S. Murthy and Dr. Rahul Chaudhary, sir, of Unnat Bharat Abhiyan Grama Arogya series for the approval of organizing the wonderful seminar. Thank you, sir. I would like to thank our chief guest, Professor Dr. J. Kulanthaivel, sir, Professor and Head and Department of Electronics and Communication Engineering. So, National Institute of Technical Teachers Training and Research for taking this precious time out of and consenting to be a chief guest, sir. So your words have upskilled and inspired the students much with this wonderful seminar illustrating the importance of IoT in telemedicine and healthcare. I thanks our respected Dean and Director, Professor Dr. B. Sendilkumar, sir, School of Allied Health Sciences, Vinaya Missions Research Foundation, deemed to be University, who graced us with us presence and guidance from this planning of this resourceful event. And constant support and have been given a lot of encouragement. Thank you, sir. So last but not least, I thank all the students for showing their interest in the program. I once again thanks everyone for making this program successful, sir. Once again, thank you very much for your great, wonderful session, sir. Thank you, sir.
Thank you very much. Hope to meet you next. Thank you.
Thank you, Dr. Dhanashekar.
Thank you.
I request everyone to rise for national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you.
Thank you, sir.
Thank you.
The feedback link has been posted in the chat box. You can fill the feedback link. You will be receiving the certificate through email. I request the participants to fill the feedback link that has been posted in the chat box. The certificate you will be receiving in the mail. Thank you. Shall we wind up, sir? Dean, sir?